I grew up in Howard, South Dakota on a farm about 2 miles south of Howard, oldest of 4, and my dad farms. My mom has a hair salon in town. My parents actually found my 5B math notebook that said I want to be a dentist when I grow up.
I grew up west of Corsica, out on the farm of my little town, New Holland. My dad farmed, had cattle, pigs.
So after school, I knew that I always wanted to come back to a smaller community. I can see the children to the grandparents in general dentistry, and that's what I absolutely love about what I do. And so without a doubt, there was no question that I was going to come back to South Dakota, and my husband knew that when I went into dental school that that's where I was going to end up. So Mitchell was just the perfect fit, me being from Howard and him being from the New Holland area. Everyone always asks us, like, I can't imagine working with my spouse, like that must be so hard. But I don't know, I think maybe sometimes at home it's more challenging when you throw the kids and everything into it.
Definitely more challenging at home versus at work.
Yeah, yes. Sometimes work's like a vacation, so we look forward to coming to work, I guess.
We're really fortunate to have a great staff here. Familiar faces, they're always smiling, they're great answering the phones, to the people that help Jen and I in the back, from our assistants to even the people that work in sterilization. And so without them, we couldn't do what we do. They're a big part of our practice.
When people typically come to the dentist, there's usually 3 things that prevent them from coming here or moving forward, and it's typically time, fear, and money. And so one of the things we find patients is thinking is just like, okay, well, I can't afford that, or insurance won't cover that, but I really want this. And it's always hard for Eric and I when people are making a decision solely based on finances. We want you to truly understand what you need, like why it is going to be the best thing for you, and we want to be able to be the ones to help you get there. So know that the time, fear, money, none of that should come in the way of you getting your dream smile or what you've always wanted.
We really like to help those patients to boost that confidence, but also that they can go out and smile big. Some of the technology we have in the office here is digital impressions, where we don't have to put that goop in your mouth. Now we just take a lot of pictures of everything using our scanner. We don't use the traditional syringe here. We use a computer injection system called the wand. And a lot of patients will say after, like, oh, you're done giving the injection already? I'm like, yeah, we're all done with that. We want our office to feel like home for patients, so that they can feel comfortable and be in here. It's not like a scary environment.
We never ever want you to feel pressured here in our office. We want you to make sure that you have all the information that you need.
Well, it's just something that we love to do, and we want to provide the best care possible for everybody that we see.
I'm grateful for the path that all my education has led me on, and that I ended up here in Mitchell, South Dakota,